Well, I'd just like to say welcome. As you probably know, I'm Nigel Brown. I'm a chemical pathologist by training, and I'm going to be talking about not pharmacology, but pathology and diagnostics. I'll just tell you a little bit about myself to start with. I actually worked in Cairns-based hospital as a hospital doctor for 4 years before I went into pathology, and in that role I also dealt with the remote communities north of Cairns in the Cape region. Then in Brisbane, I trained at Royal Brisbane Hospital, but then went into private practice groups for 12 years where I looked after, it was in QML pathology in Brisbane and Laverty's in Sydney, and it's largely a GP-based practice, but also it has a large, reasonable rural component as well. So when I was in Sydney, I went round to the different Western New South Wales remote areas as well. What I'd like to talk about today is to give you largely give you some approaches to pathology, because I really do agree, and I congratulate you on nurse practitioners getting their elevation. That's long overdue. As part of Metro South, which is the Princess Alexandra Hospital, where I'm Director of Pathology there, Metro South looks after health on the south side of Brisbane River down towards until you hit the Gold Coast. And I sit on the Nurse Practitioner Credentialing Committee, and also one of my roles is to sign off the nurse practitioner's ability to order pathology through Pathology Queensland, which is the pathology service, the public pathology service that covers Queensland. So and also we have a system of authorising different nurse practitioners in the various medical units in the hospitals themselves to carry out their work, including ordering and looking at pathology results. I wasn't quite sure how to pitch this talk, because I think sometimes there's sort of a range of different people, so I just want to get some indication from you, firstly what sort of practice settings you're from, and also with your expectations whether you're someone who is already looking at a fair number of pathology reports, or try and avoid pathology reports, or where you sit in that sort of education sort of continuum. So I don't know who is sort of primarily involved in, say, what you might call a straight general practice or urban general practice, sort of more regional or remote practices. And who sort of feels, and I won't hold it to anything, who feels confident with pathology? Some, yeah. Who doesn't really have much to do with pathology, and that's not really their thing at this point in their career or whatever they're doing? Okay. So that gives me an idea of how to sort of cover things. One of the first things I'll talk about is just a general approach to learning, and I wanted to try and use it in this workshop as well. And it's something that when I'm supervising trainee pathologists, I try and encourage them to do, and it's something just learning through asking questions. Because one of the things that a lot of neuroscience has shown is that one of the ways we remember things is by getting them to stick on to other bits of information we already have in our head, as well as being interested in it and paying attention to things. So this is from a book I really like by Peter Brown, who talks about a book called Making It Stick, and it's in Kindle versions if you want to get it, not fairly cheap. But there's sort of 4 steps that they cover when you're learning about something. One of the things he recommends is actually ask yourself some questions even before you start into the topic. This sort of primes you to be thinking about that area, and even if you get the answers wrong, so even if you find your answer to the question was completely wrong, still having thought about it sort of primes you to put the results back into your memory. When you're going through, that other type of thing to ask is, well, how does this impact on me personally? And so that might be cases you've seen in your practice. It may be a family member who's got a particular condition, or maybe your own condition, or it may be just something you'd seen on the news that was interesting. But try and link back what you hear to your own personal experiences or personal interests. Then again, straight away after you're done, that's a good time to ask some questions again. Hopefully your answers are a little bit more on track at the end, but having asked them at the beginning will set you up for putting the things into memory. And then the next task really from straight afterwards to later is to basically practice recalling, because if you've heard something but you can't really recall it, maybe it gives you sort of a general idea which you can apply, but if you really want to recall something, then it's been shown that frequent, like small attempts at recalling are better than sitting down saying, okay, I'm going to spend 3 hours going over those notes on lipids, whatever you want to do. It's better to do shorter periods and mix it up with other things. So a bit of lipids, a bit of wound care, mix things up as you're going through, and that will also help you do the recall. So the type of things you might say if we're going to talk about lipids. So you might think to yourself, well, what are 4 tests that you see under when you think of a lipid profile? What are 4 tests that you think about under the profile? And you don't need to give me answers, but just in your head think, well, it might be cholesterol, triglycerides. He wants 2 more. What are the other ones? LDL and HDL. So there's your 4 lipids. Then when have I been interested in lipid testing? So I think back to a particular practice scenario or person, as I was saying, that actually sort of sparked your interest in things. I'll give you a moment to do that. Then one of the main things is why do you measure cholesterol most of the time? And this applies particularly in community practice. Hospital practice, you could almost argue you almost never need to measure cholesterol. It's mainly a primary care test. So have a think about why you might be interested in cholesterol most of the time. And then another thing is, well, what sort of diseases might give you high triglyceride levels? And in general practice, there's probably 2 main situations you see high-ish triglycerides in. Some you see very high, but there's a couple of common patterns you'll see. So with those sort of questions in mind, we'll move on. I've been told I've got to stand a bit in front of the microphone. And if you ask any questions, I'll encourage you just to ask questions as we go through. So if I'm not clear on something, if you didn't hear something, if I went over something too quickly, or you want to go down a sidetrack, feel very free to stop me and ask questions. So we've got time to go through things and ask questions as well.